All right, babe, you ready?
Yep.
All right. 5, 6, 7, 8. Firms and the sauce. Say what? Firms and the sauce. Elo. What's up, everybody? Welcome to episode 3.
Woohoo!
We made it to episode 3. As you can see, we're at a little different location. We are inside instead of out. Talk to me.
Yeah, it's about to start raining. Really, really cold outside now. Not really, really cold, but starting to get really cold. So we're going to move things inside.
Absolutely. Really cool. We just went to Tea Life to get our drinks. Okay.
I have the Mama Chata today.
I have a Bobby V, and this is Vietnamese coffee and Thai tea.
Mine's our horchata with dragon fruit.
Yeah, so this is awesome. Shout out to the good folks, Annie and Candy from Tea Life. We just met them. They're awesome people. We're regulars now.
Yes, we are.
They know us. We know them.
Get your local boba at Tea Life.
Exactly. Tea Life. Shout out to y'all. All right, so this is going to be a little bit interesting. This is more...
Yeah, today's episode's going to be more serious. The past two have been a little bit more on the fun, friendly, quirky side, and today we're going to take it down a notch and have a serious conversation.
Serious conversation. This is Taboo Talks with Thefermsandthesauce.
Yep.
All right, so let's just get straight into it.
Yeah.
What we're going to talk about is... Go ahead.
The first episode of the segment is going to be about euthanasia and medical / physician assisted suicide.
Right.
To backtrack a little bit, we took a poll on Instagram. Right. We asked you guys, what are some taboo topics that we should have more discussion about. And a lot of you replied, and it's incredible. So thank you. Thank you so much.
So much that we didn't know it. We cannot fit all those topics in one episode. And impossible. It'd be like an 8-hour episode.
Yeah. And so we were talking about it. We figured we'll do one topic per episode.
Yeah.
And the first one we chose was euthanasia / end-of-life decision / physician-assisted suicide.
Yeah. Do not feel ignored if we're not talking about the discussion that you wanted to talk about on here. We will get there eventually, but we just decided, hey, let's do a euthanasia for our first episode.
Yeah.
Now, guys, real quickly, this is euthanasia. This isn't youth in Asia. Okay, we're not we're not gonna go to China and
spell euthanasia.
Easy, EUTH Asia, right? Euthanasia.
That's pretty good, yeah.
EUTH.
Yeah. You got
Asia.
It. Yeah. We'll spell check that when we edit this. All right, so.
Okay, and I will say Cherry's probably going to know a little bit more than I do when it comes to this, but we talk about this regularly, believe it or not, and of life decisions.
And it's important to talk about. I will preface with that. We both have backgrounds in healthcare.
Right.
But I will preface this with that you should have some sort of conversation with your loved ones about what kind of care you would like to receive in the event that there is an unforeseen medical emergency. We'll go more into that in a little bit, but to start things off, let's talk about what is the difference between euthanasia and physician-assisted suicide, because there is a difference. Do you know?
Okay, euthanasia. No, I you know what? I'm not gonna lie. I think I'm thinking hospice.
Okay, yeah. Talk a little bit more about that, because
hospice or euthanasia.
Talk about what you think. The differences
euthanasia.
are. Yeah.
All right, so euthanasia is medical-assisted death. Okay, that's what I think. I think that euthanasia is kind of like, hey, I want to end my life. Don't give me treatments. I'm okay with dying.
Okay.
What's the definition?
Yeah, you mean that's correct. And pretty much. The big difference between euthanasia and physician-assisted death, physician-assisted suicide, physician-hastened death. There's so many terms that people go by these, and they're not the same. Mm-hmm. So, but euthanasia, the big difference is that who commits the last act of it. So with euthanasia, it's such a fine line because it's tricky. Some people refer to voluntary euthanasia in healthcare as, for example, working in healthcare and someone is dying and you are helping them to die. For example, administering medications that will eventually lead in their death. Some people think that is voluntary euthanasia because the medical provider or healthcare worker is helping the patients do that. Whereas physician-assisted suicide, physician-assisted death is when a physician gives you a medication that you, as a patient, as a person, you take it yourself whenever you're ready.
Man.
And there's a couple of things that go into physician-assisted death, because first of all, you have to be deemed in the right mind to make this decision to want to end your life.
Yeah.
You have to have some sort of terminal illness in which your prognosis is poor, that you'll probably die within the next 6 months or so, and you have to be cleared by two professionals, doctors, for them to be able to give you this medication. And then lastly, you have to be able to be sound enough to take the medication yourself, So there's these different categories that you have to go through to be able to do this. But it's not legal in all states. It's only 9 states. In California, you have to go through a court of law.
Man.
How do you feel about that?
Man, it's weird. This is taboo, right? This is why we talk about
Why
this.
is it weird though? What are you against it? Are you for it? How do you feel about euthanasia, voluntary euthanasia versus medical assisted suicide?
I'm for it. I feel like,
for both?
Yeah, I feel like if a person wants to end their life and they know okay, I'm going to end it. Mm-hmm. Okay, that is their choice. That is their fate. That's on them. Mm-hmm. All right, and they're okay with that. Physician assisted death or physician assisted.
Yeah, there's different terms. Man. Yeah, I mean, physician assisted suicide is that's really harsh.
See, just the word suicide.
Yeah,
in there.
and a lot of big companies, governing places, they don't like that term because it's not suicide. I don't know. This is so hard for me because I work in the healthcare field, and so this is an ethical issue.
And you know why it's hard for me is because I teach people how to, not die.
Right, and that's the same.
So that's why I'm
yeah. And anyone who works in healthcare, we aren't taught how to, help people die, so to say. We are there to help them get stronger, better, live a healthy life. So granted, there are professionals that work in hospice or palliative care, and they specialize in helping someone transition into that more peaceful death, or more natural, right? Yeah. But for the majority of us, we want to help people live, right? So it's not natural to think, I'm going to help someone
die.
For me, I see both sides of it. As a nurse, I can understand when someone is in the hospital. In fact, I've had experiences with it when I was, starting out, new, 3 months or so into my career. I had a couple patients, terminal illness, cancer. Both of them were cancer patients, and one of them literally my first day with them, the only day actually I was on the floor, and they said to me, "Oh, I came to your unit to die."
Man.
I came to
Wow.
your unit to die. And
wow.
I mean, I didn't know what to say to that. This gentleman was like 40 something years old, but
Jeez.
he was very, very sick. And where I work, we don't deal with cancer patients often. It was busy winter season, and there were no rooms, there were no available beds in other units, so we had to take the patient and pretty much help him pass on.
Man.
And they're on a very strong medication. It's a drip. I think he was on a fentanyl drip. And the way that it works is you titrate it. So if they're not comfortable, if they're still in pain, because when you're dying, it's not pleasant. You're in a lot of pain. Mm-hmm. And they're on a drip, and you have to titrate it to certain levels that can be uncomfortable for you as a professional, because you feel like, oh my goodness.
For example, people watching this might not know what the word titrate means.
Oh, sorry.
Like
titrate is for example, I'll just give a quick example. If the order is like 10 mils in 1 hour, and then increase by 20 mils if they're not comfortable. I'm just making stuff up, but so pretty much you're going up in the dosage, in the rate of the drug, and you want them to be comfortable enough to where they're not in any pain. So some people will say that is voluntary euthanasia, that you are participating in an act to help someone die. But is it if that's a person's wish, and you have to respect that in a professional setting, right? And that's these situations. This has happened to me twice, but situations like that, I get super. It really does. It really gets to me, because the other side of me that's not in the medical field, my morals is like, I want to help you, but I don't. It just messes with me, because I want you to live. You want everyone to live, right? But I'm not in the position. I'm not sick. I'm not the one that's suffering with the pain, with all of that. So there's that end to it.
That's your human instinct.
Exactly.
Right
yeah.
That's the reason why you got into the medical field. Mm-hmm. Is because I want to help you, not help you.
Right.
So that is weird. But shout out to all nurses. Shout out to anyone in the medical field that does deal with this type of work every day. Like,
it's hard.
It's hard.
So hard.
And that's why I'm not in that field anymore. Because I couldn't do what you folks do. Like, shout out to you, to my mother, to my father, to everyone.
Yeah.
Okay. Anyone that's in the medical field, just shout out to you guys, because not everyone can do what you guys do. And so anyways, I know that was kind of sidetracked.
No,
but
that's okay.
Just like an appreciation to you guys.
And
continue. Educate us.
So that's, what people would argue is voluntary euthanasia. On the other hand, there's the physician-assisted death, which I feel like I don't have as much of a moral issue with that, because you, as a patient, you are the one that is administering the medication to yourself, right? Yeah. When you feel like you're ready to do so. And I guess that's different than me doing it to you, So it's a little bit different in that sense, but there's still a lot of controversy around it.
Man, I just I don't know. This is why we need to talk about this, because look, I came from the medical field, right? And I'm transitioning out. Not a lot of people talk about this stuff.
No.
So this is why we need to talk about this kind of stuff. How do you feel about you know what? This is a good conversation. Sorry. We talk about this from time to time. What would you do if blank, blank, blank?
Mm-hmm.
Right? Fill in the gap.
Yeah.
What would you do if you're on your dying bed and you're hooked on to life support?
Oh, okay. Oh, well, we're going this route now.
Let's go with this route.
Okay. Well, a couple things that you guys should know, or you know, that there are tools out there that you should be aware of that will help make it easier for your loved ones to make decisions in the event that, you know, you are in a hospital bed, pretty much on your deathbed.
Yeah.
We'll go into that in a little bit, but for me, if you were to ask me in this time and age and right now, and I'm hooked to what exactly?
Everything that makes you breathe.
Yeah. No. Plain and simple, if I can't breathe on my own, if I can't eat my own food, I don't want to live. Because it's a quality of life thing, you know? Even if I'm on vents and I'm on feeding tubes for months, you know, and I'm able to come out of it, what is my quality of life going to be like from that point forward? Am I going to live a happy life? Is my recovery going to be the same? I might as well just be dead. I mean, it's harsh, but that's how I feel about it, you know?
Yeah.
But I also see people that on an everyday basis that are hooked up.
Yeah.
And I know what it does to the human body. I know what it does to family members. And I don't want that. I don't want that.
Yeah. You know, Cherry and I had this discussion a little less than a year ago. She asked us, saying, we're driving. She's like, hey, what if
we always talk about it.
Yeah, that's what we talk about. So I guess this isn't taboo if we talk about it. No, but we talk about, what if you're hooked up in something? How many months? How many weeks?
Yeah, because you said something. Yeah, what did you say?
I was like, give me 3 months.
Yeah, if you're not able to like snap out of it.
If
or like
3 months.
You can't recover, yeah.
Pull the plug.
Yeah, I mean, I guess for me, the only thing I'll do is if it's temporary feeding tube, like I'm talking about like NG tube status, not like G tube in my stomach. If it's temporary and like the prognosis of me, being able to eat real food again is very high, then I'll do it. But anything else further than that, no.
Yeah.
Yeah, I don't want that. Man, that's hard.
Very
hard. Because then, yeah, like you come out of it, and then how do you think you would live again?
See, that's the thing. Remember, this is why I brought it back up, because now that you mentioned that quality of life, is it going to affect other family members? Now I want to change my answer.
No, but granted, there are some people that are able to.
Willing.
Remember that girl that we met at it was like one of the family gatherings or a party in the park or something. Remember that? And she had a trach scar.
Yeah.
And she said that, I forgot what happened to her, but she was hospitalized for a long time, and she had a trach, and the whole thing. She was talking about it, and she, appeared to have been living okay, transitioning. Right. And there are people, it can happen. There are people that come out of it and they live on a great life, but it's a very personal decision.
Yeah.
And that's another level to it as a healthcare worker, is regardless of your own personal opinions about something, you have to respect that.
Yeah.
Which it really messes with you. Yeah.
Once again.
Yeah. But let's talk about, because we're on the topic of this, advanced directives.
Okay.
What do you know about advanced directives?
That person has your life in their hands, and their pen and on their signature. Is this person gonna need are they DNR basically?
Right.
DNRs do not resuscitate. Go ahead.
So no. I'm
educate us.
No, I want to know what you know.
Like, that's all I know.
That's all you know.
That's all I know.
No,
DNR,
you're kind of you're on the right.
It's gonna be on their bed, or maybe some people have it tattooed on them.
Yeah, some people. Oh, you heard about that story where the guy had tattooed "Do not resuscitate" on his chest, and he was a young guy, I think, and then he got into some sort of accident, and he was in the ICU, and he was dying, and
did they do it?
And the chest read, "Do not resuscitate." I don't know what the outcome was, but then that's a conflict because you're like, is this a joke?
See, sometimes I get that question when I'm in class, all right? And they give me that question, hey, what if someone has do you stop? And because that is...
someone has a what?
A DNR, like a tattoo.
Oh, a tattoo.
Or like, what if it's like a family member saying, hey, don't resuscitate, that's my...
Okay, good question, because it depends where you are.
Right. And then this is what I say. I just say, hey, that's beyond my level of scope of training. Right. I do not know the answer to that because I don't want to give you false answers. I say, I don't know.
That's
what do you know?
That's smart. Yeah.
You have to.
So advanced directives, you're on the right track. And people get this confused all the time. What is an advanced directive? What is a durable power of attorney? What is a living will? What is a POLST? Because those are
a pulse?
POLST.
Oh,
POLST.
Okay.
You probably haven't heard of it because you're too young. I mean, we're too young. It's.
See, I didn't even know. Okay, go ahead, educate. Start.
So a POLST stands for physician orders for life-sustaining treatment. So it is different than advanced directive, but it doesn't take the place of an advanced directive. You can add it onto your advanced directive, but it's mostly for people who have terminal illnesses, elderly people that are very sick. They usually have a POLST, and it is a medical order that is provided by a physician. So you know, for example, let's say you have a terminal illness and you talk to your doctor, and you and your doctor come up with specific medical treatments in the event that something happens to you and you can't make decisions for yourself, or what would you like done, what would you not like done, in very specific details. It is a medical order, physician orders. So that a lot of elderly people have that because, if you are at home, you're like 9 years old, and you go in a cardiac arrest, and you call, and your granddaughter calls the EMS, and EMS arrives on the scene, and they ask you, does she or he have an advanced directive? Do they have a POLST? And you said, yeah, she has a POLST. She has a DNR. Then EMS cannot provide resuscitation, because a POLST is a medical order from a doctor, but an advanced directive is a legal document. If that was switched around and you're your age and whatever, and you only have an advanced directive, by law, EMS has to do everything in their power to revive you until you reach the hospital.
Oh, wow.
Yeah, so
that's intense.
It differs in that sense. And so POLST is POLST you get, right? Okay, and then advanced directive is a legal document that you're able to write down generally what would you like done, what would you like not done in an event of an emergency, medical emergency. And within an advanced directive also is a surrogate or durable power of attorney, meaning you appoint someone to make decisions for you if you cannot make them yourselves anymore. But granted, if you're appointing someone to make those decisions for you, obviously you've had the conversation with them. Even if it's in writing, you still have to, the logical thing is to have a conversation with them about your decisions, right? And then a living will, that's another added piece to it. But pretty much, you and I should actually already have an advanced directive, and we should. I mean, I'm comfortable to start one and to make one for myself. That's your choice, but you can always change the advanced directive. It's not like I'm doing it and it's set in stone forever. You can always change it, but that's It's a really good idea for if you're our age, maybe even older, watching this podcast. Think about it, because every day, exactly, not every day is a given. We're lucky to have woken up today. No matter where you go, what you do, you don't know what's going to happen to you, around you. the world is scary. You know, life is short. Yeah. It's cheesy, but it's true. And it would be so much harder. How would you feel if something happened to you? And how would you feel if something happened to me and we never talk about this and I'm on my deathbed, but we've never had a conversation about what do you want, you know, and the doctors are bombarding you. What do you want her to do? What do you want her to do? Like, do we save her? You know, do we start a feeding tube? Blah, 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 blah. There's so much pressure on you, you know? And then if you're not in the right mind, if you're in a coma, like, you don't know all of this is happening. Like, it's so unfortunate that people don't talk about this because you leave your loved ones with the burden of having to make that decision for you. Man. When you can make that decision for yourself, you know?
Right. It's never too early to talk about this.
But it's hard.
Because we don't talk about this.
Because people don't view death. I mean, no one wants to think about death. But it's a part of life. You know, it's, you know, not a side note, but we talked about this probably 2 weeks ago. You're like, you know, growing up, I always thought about death. Remember we had that conversation? We talked about everyone's like, what?
Yeah.
Is this
even taboo if you guys talk about this? The reason why we talk about this is no one else will.
Yeah, I've always...
Our lives revolves around social media. And I'm not talking about you and I. I'm talking about
everyone.
Our generation, from 5 months to 5 weeks to 5 years to 95 years old. Social media revolves around our lives. Everything is now based right here. Okay?
Right here.
Right there. Right here. Right there. Right here. And because what we want to know is the good stuff.
Yeah.
Oh, there's a solution for... age for wrinkles. There's a solution. You know what's funny? Why is there we never used to talk about self-care before. Self-care was never a thing. You work hard, so now you could play hard. Right? Self-care 20 years ago. Now you got to take vacations because you work hard.
Right. It's not as glamorized. It wasn't as glamorized back then as it is now. Because
you need to get bath bombs because you had a stressful day. Self-care.
But self-care, now, you know, the big thing is self-care can be anything that makes you feel good.
Right.
When self-care first came out, it was like, oh, you know, treat yourself, you know.
Right.
Well,
by the way,
nothing's wrong with
nothing
that.
Is
nothing
wrong
is
with
wrong.
That. Take care of yourself, people.
But, you know, to others, it's like, oh, I don't have the money for that, or like, I don't have time for that. Like, you can do whatever you want to take good care of yourself that makes you feel good. It doesn't have to involve money or whatever it is. But that's another topic.
Back to here. But by the way, so self-care, take care of yourselves, good folks. All right? Please take care of yourselves.
Yeah.
Back to death.
Yeah, you were mentioning how last week we were on a walk with Elo and we were talking about you know, I was telling you, you know, back when I was younger, I don't know how this started, why I at a young age started thinking about death like that. I just did. And I just felt like, you know, why are people so scared to talk about death? It's such a natural part of life. In fact, I think cemeteries are one of the most peaceful places to be because it's so quiet and people go there to visit their loved ones and they're never interrupted. And I just think that we need to start talking about that. You guys need to start, you know, talking about this. And it's hard. I think there's a documentary on Netflix about this too. It's hard to have a conversation, you know, with your partner, more so with your parents, you know?
Yeah.
Remember I asked your mom one time?
Tough. Yeah.
I was like, what do you want done if...
She's like, I don't know. Nothing.
No, she's like, I want everything done. Oh, yeah. You know? Which is fine.
I respect that,
if you want everything done, you want everything done.
I respect that.
What, you know, for me, like if you were to ask me right now, at this age, this time, if I go into cardiac arrest, yeah, resuscitate me, bring me back to life.
I got you. I'm good at that.
Bring me back to life.
I'll be good at that.
But if after that, for some reason, I need to be hooked up on vents and stuff for this amount of time, then no matter my age, even if I'm 26 now, or how old am I? 25 now, or 96 later on, I don't want that.
Okay.
But if I'm 96 and I go into cardiac arrest, or 86 or 81, no, let me die. Let me go. I don't want to. But because that's from 25 to all the way, that's a huge chunk of my lifetime already. I would have lived a good life already. I don't want you to revive me and my brittle bones and bring me back to life at 86.
Yeah.
You know?
I can respect that.
Yeah. What about you? What? Tell me, what if something were to happen to you? What are some things you can think of at the top of your head that you would like for me to do or not to do?
Do CPR right away. Get that AED right away. All right. 27 years old to 87 years old. Do CPR on me.
Okay.
Do CPR on me. Work that AED on me. Because, you know, it's important to me. It's a big part of my life.
Right.
Now, when things need to get attached, see, my answer's changed here because I don't want it to affect anybody else. I don't want the financial burden, taking, activities of daily living surrounding me on a constant basis. I used to say, do everything.
Yeah.
Now it's less is more. Okay. I want my family to not have to worry about me, but just worry about yourselves. I had a good life. I'm not dying or anything, but like
this is really getting really dark right now.
But I had a good life. I am happy I am joyful with everything that I've.
And you did all you could.
Yeah.
You know, sometimes if it's time, I honestly believe that. I feel like if it's time, then it's time.
Yeah.
You know?
And that's why people don't want to talk about it. Speaking of time, there's that there's the movie with Beck. There's an app that tells you when you're gonna die.
From the movie?
It's the movie.
Oh yeah.
I forgot what I think it's called. Death.
Yes, we saw that preview.
Yeah, and it's from Beck from You.
Yeah.
Very good Netflix series.
Yeah, I wonder what that movie's gonna be like.
They're trying to cheat death.
Yeah. Which you can't, I don't think. I was going to say something about that whole living thing. Oh, yes. So that's how you feel right now, right?
That's how I feel right now.
Yeah. But who's to say that 10 years from now your feelings might change,
Yeah.
Because we change as humans. Our goals change, our priorities change when we grow older and have families. Our lives change. So with that, comes changes with the way we feel about certain things, right?
Yeah.
I don't know. I've never filled an advance directive out myself, so I don't know the nitty gritty of it. But if I was pregnant and
Hello.
This is one thing I want to I don't know if I could state this in my advance directive, but if I was giving birth to a child, my child, and the doctors had to choose, if something happened, knock on wood, something happened, and the doctors have to choose, they can't save both, they have to save only one.
Man.
Save my child. Remember back then I was like, save me. me. But that was several years ago. And now I feel differently. I don't have a kid. I'm not a mom or anything, but I could only imagine the amount of attachment as a mom to be mom when you're carrying someone in your belly for 9 months. I've lived 20, 30 years, and my kid hasn't had a chance to even take a breath of air. Let the kid live. Let the kid live.
And let the kid live.
Yeah.
This is why we need to talk about this, because not a lot of people will even think about that, or maybe they do, but you guys just don't want to talk about it.
Mm-hmm.
Let it talk about it because this is important stuff.
It is very.
Cherry and I, we've been together for 5 years, and we don't want to sound weird, but we talk about this regularly, believe it or not. Okay.
That was his 10th time stating that.
Yeah. And I guess the reason why we chose this topic is because for Cherry and I, this might not be so taboo.
Mm-hmm.
But for you, and go ahead and point at the camera right
and
there.
You.
Might be taboo. So talk about it.
Yeah, talk about it. Have the conversation. And it's not going to be easy. It's not supposed to be. It's supposed to be uncomfortable. It's supposed to be maybe a little messy. But better for it to be messy when you're alive and breathing than when you're not.
Hello.
You know?
Check the scene. Call 911.
Sir, are you all right?
Yeah. So,
who's texting you?
Rolling.
Yeah. I mean, those are my thoughts about it.
Final statement?
I just made my final statement.
I think that what was that quote? You don't start living until you step out of your comfort zone.
Life starts at the end of your comfort zone.
Life starts at the end of your comfort zone. Okay? So talk about life. It's going to get uncomfortable, but you need to talk about it. Talk about life because you're going to need to talk about death. All right. Okay, now we're losing it.
He's just trying to find something to say. You have very sleepy eyes right now. Are you tired?
No, just a lot of things I did today, and then late night last night and early morning. But it's okay.
Yeah.
But I love doing this because this is what drives me. I love doing podcasts. I love our listeners.
Yeah.
Thank you guys.
Thank you. Yeah, that's all we have for today, I guess.
Okay. Right? Taboo Talks with the Ferms and the Sauce.
Yeah.
5, 4, 3, 2. Ferms and the Sauce. Say what? Ferms and the Sauce. ELO. Thank you guys. Episode 4 coming out next week.